In clinical trials, we move a drug through different phases of assessment. Phase 1 is early phase, does it work? Phase 2 is about what dose. 3 is how does it work compared to standard therapy. And phase 4 is a phase of a clinical trial that we often forget about. The EXELS study, which is presented at this Congress by Gunnar Bergergaard on behalf of many clinicians in Europe, is one of those studies. It's a phase 4 study following up almost 3,500 patients with essential thrombocythemia treated in Europe. It's a phase 4 study following on from the approval of anagrelide, which is an oral agent we often use to treat patients with ET, but looking at longer term safety and efficacy. That means how effective is it at controlling the blood count, but also at preventing complications for disease, particularly of course blood clotting events, bleeding events, etc. So this is a very, very large study, and it really has enabled us to learn quite a lot already about ET. So if I can share with you what we've already learnt from that study. So we've already learnt that the treatment patterns for ET change a lot across Europe. Some countries are using a lot of interferon, some less. For example, in the UK, we have the highest proportion of patients treated with hydroxyurea or hydroxycarbamide. We also learned already from that study about management of patients over the age of 75. We wrongly have a focus sometimes on younger patients, but we learned about how our older patients and even over 85s were a cohort of patients we could study in this trial, looking at how did they fare with treatment. But moving on to what we're presenting at this meeting. In this meeting, we're showing the final results of the study, so reporting on just those aims: safety, effectiveness of anagrelide across these 3,500 patients. So about 1,500 patients treated with anagrelide and about just over 2,000 patients treated with other agents, mainly hydroxyurea. What we saw is very reassuring and quite consistent with what was seen in the earlier phase 3 and phase 2 studies with the agent, but represents a really important and very reassuring piece of work. We saw that the control of the blood count is pretty much equivalent across all of these therapies. We saw that patients, once they're stable on the drug, tolerate the drug extremely well. We did see a little bit more bleeding for anagrelide treated patients who were already taking aspirin. This is something that we saw in earlier studies and is already widely known amongst the medical community. In addition, we saw that all of the agents were very effective at preventing blood clotting events, but that we saw slightly more events for patients treated with anagrelide. This is very important data. Yes, it backs up what we knew already, but it tells us more about the use of drugs in the everyday setting. When we do standard clinical trials, we're often selecting a very small proportion of the patient community and assessing them in a highly controlled environment, not looking at how we use drugs in everyday life. And that's why I think it's really important that this study is highlighted to the patient community from this meeting.